Alright guys, so I'm trying to talk about the application of another test in trying to evaluate for thyroid disease. This is what is known as a radioactive iodine uptake assay. So you want to see the application of this in trying to evaluate or confirm if there is a thyroid disease at all. So this is the whole process. You give a radioactive iodine, is ingested, and the result will basically help you to know if there's a thyroid disease condition or not. Right. So radioactive iodine uptake assay is a diagnostic test which is used to evaluate thyroid function. Right. So you want to now measure the thyroid gland's ability to be able to absorb iodine. Right. So purpose is basically to diagnose hyperthyroidism diagnosis, thyroid nodule assessment, pre-treatment planning. So for the hyperthyroidism diagnosis, this differentiates between causes of hyperthyroidism. Is it Graves' disease, which you see that there is high uptake of the iodine, or is it thyroiditis, which is inflammation of the thyroid, right? So that one, there will be low uptake. Then also thyroid nodule assessment. That one, whether a nodule is hot, is functioning, or a nodule is cold, is non-functioning. You get? It will help you to know. Then pre-treatment planning. You want to determine the iodine uptake levels before radioactive iodine therapy for the hyperthyroidism is now given. Right? So procedure is the radioactive administration. So you give about iodine, okay, could be the 123 or 131, is given orally or intravenous. The measurement now, so a gamma probe measures the amount of the gamma probe measures the amount of iodine that is absorbed by thyroid gland at specific intervals. You get? Alright, so intervals of about 4 to 6 hours, then 12 hours, right? So interpretation, high uptake, if you are seeing a high uptake, it shows that maybe there's Graves' disease or there's toxic multinodular goiter. There's low uptake, indicates things like thyroiditis or iodine overload or hypothyroidism, right? So this is just how you can be able to use this radioactive iodine uptake assay to confirm, right? To confirm the thyroid disease. Okay.